Good evening, class. My name is Liza Wall, and today I'll be presenting my genetics project over schizophrenia. The American Psychiatric Association's definition of schizophrenia is a chronic brain disorder with symptoms that include delusions, hallucinations, disorganized speech, trouble with thinking, and lack of motivation. Other definitions include a 6-month time span that these active phase symptoms are expressed, and I will get into the different types of symptoms on the next slide. Schizophrenia symptoms are classified into positive, negative, and disorganized. Positive symptoms include the enhancement or additional signs and symptoms of your 5 senses. So this would include hallucinations and delusions. Auditory is when you hear voices that aren't there. The TV is speaking to me. Visual would be seeing people or patterns that aren't real. Olfactory and gustatory would be the smell and taste of something that may not be there, or something that tastes bad tastes extremely good to them. Tactile would be the feeling of what is typically described as insects crawling on the skin, while delusions may include hyper-religiosity, meaning that the individual thinks they have godly powers, or grandiose thinking, that they are superior than the average person. Negative symptoms are things that are taken away. So the inability to speak, the inability to concentrate, the inability to empathize with emotions. And lastly, disorganized symptoms include disorganized thinking, making connections that aren't there, emotions that don't fit the scenario, such as someone being happy that there was a death. And a lot of these individuals also have a flat affect and are monotoned. And I won't get into a whole lot of this, but there are some subtypes of schizophrenia, such as paranoia, disorganized, and catatonic. But those will not be discussed in depth. There's currently little known about the development of schizophrenia. However, with recent technology advancements, geneticists have found a correlation between chromosome 22 and the development of schizophrenia. Specifically, chromosome 22q11.2, the microdeletion, deletion, and duplication of this has led to multiple syndromes, including schizophrenia, velocardiofacial syndrome, which is what the woman has on the PowerPoint. She has a hypotonia face, narrow eyes, and almost puffy-looking eyelids. And Kehler syndrome, which is what the infant has, and you can tell with his asymmetrical smile. The mutation of this chromosome has also been correlated to medical complications such as congenital heart defects, cleft palate, hypoparathyroidism, and immune deficiencies. Expressed findings of psychopathology associations such as learning difficulties, autism, language delays, and attention deficit disorders are found. But there is a prevalence difference. 1 in 4,000 live births will have a deletion syndrome. However, schizophrenia affects 1 in 200 individuals. So there's more individuals with schizophrenia than one of these deletion syndromes. And this goes to support the theory that neurodevelopmental contributions are found with individuals that have social economic disadvantages, personal trauma, or enhanced stress among family, education, or occupational areas of life. It's also important to know that schizophrenic patients are very vulnerable. They are at risk for homelessness, neglect, abandonment, abuse, and a high risk for suicide. Individuals with schizophrenia suffer due to the increased production of dopamine, specifically at the D2 receptor. These receptors are located within the brain at the striatum, nucleus accumbens, olfactory tubercle, hippocampus, amygdala, and cortical regions of the brain. So this helps explain why they have the symptoms that they do. The goal of the pharmaceutical is to block 70% of these receptors. The most common medication of choice is haloperidol or Haldol. Haldol allows for the blocking of these receptors at the postsynaptic junction within the brain, and this aids in relieving the positive and disorganized symptoms that these individuals have. Adverse reactions, though, include difficulty speaking, loss of balance, a mask-like face, muscle spasms, and EKG changes due to the use of potassium channels. And this is why it is important to monitor these individuals, especially for QT interval changes. So what can we do as providers, friends, or family? As providers, we can encourage medication intake, ensure that they are taking these medications as scheduled, they're not missing their dose, and they are coming back for frequent check-ins. As friends and family, we can offer support and help monitor for the prodromal phase, which is a pre-psychosis phase, and we can encourage behavioral and cognitive therapy. These individuals are pretty vulnerable, as I described earlier in the presentation, and they do suffer from homelessness and abuse due to the signs and symptoms that they have. So it's important to really support these individuals. So ethical dilemmas arise with the genetic testing of schizophrenia due to the detrimental side effects it has on individuals, families, and concerns for stigma and discrimination. The genome-wide association studies have helped to identify biological pathways. However, there is discrepancies between the syndromes, such as the deletion syndromes I mentioned before and schizophrenia. It also draws a fine line between benefits and non-malfeasance, which allures concern for knowing. There's also ethical dilemmas with treating the prodromal phase, which is the pre-psychosis phase. And this is actually a question I had when I was starting this presentation, was why don't we treat patients that have been known to have schizophrenia or relatives of schizophrenic patients before they occur? And that has also led to ethical dilemmas because it offers an increased risk of suicide, depression, anxiety, and active phase symptoms. So those are some ethical considerations. I would like to conclude this presentation by saying that individuals with schizophrenia can live happy, healthy, and fulfilling lives with the correct treatments and support system. And so I hope you all enjoyed this presentation, and I look forward to watching all of yours as well. And these are my references. Again, I hope you all enjoyed the presentation, and I look forward to watching everyone else's.